I practice in New York City at a large academic medical center. In my role as the Director of Clinical Cardiology, I oversee both the inpatient and the outpatient care of the general cardiology patients, but obviously intersect very closely with the other subspecialties: heart failure, electrophysiology, cardiac cath. When we started our screening process for sleep apnea, many of our patients were confused as to why a cardiologist would be asking them questions about their sleep hygiene and their sleep habit. But when we explained to them that our focus was trying to understand the total patient, and that this is part of a very holistic approach to the patient, that we're not just taking care of a heart, we're taking care of a total person, I think they began not only to understand, but actually to appreciate our focus on prevention. And I think that was especially important for them to understand that we're not just looking to fix over problems with a prescription, but that we're trying to understand the underlying cause of their problem. There's a great deal of awareness now in the community about sleep apnea. Many patients know famous celebrities or other people in the news who have sleep apnea, and most patients know someone who is using a CPAP device. So therefore, many of our patients are acquainted with the old-fashioned ways of diagnosing sleep apnea, which requires the patient to travel to a sleep lab, often to get an appointment that's given to them many months in advance. Our patients are very appreciative of the fact that, number one, we as cardiologists have ownership over the sleep diagnosis process so that we can refer them directly from our office for the home sleep testing without a requirement for another appointment, another referral, another delay. We have seen many patients who tell us that after treating their sleep apnea, they find it easier to lose weight. Many of our patients tell us that they find themselves more energetic during the day, that they're better able to concentrate. On our end, on the clinical side, we have noticed that our patients who are adherent, particularly those with the more sleep apnea, the more severe sleep apnea, we've been able to reduce or eliminate some of their medicines for hypertension.